Hi, and thank you for joining us for this edition of National Council Conversations, where we're going to reflect on 1 year into the pandemic and what has it meant for the workforce, particularly women in the workforce. I know just this weekend there was a big summit on women caregivers that kind of highlighted some of these issues that women are leaving the workforce in higher proportion than men, and that they're also feeling more pressure at work. We know that behavioral health organizations aren't exempt from these same kind of realities. And I'm so pleased to be joined today by my colleagues, Dr. Linda Henderson-Smith and Ami Roeschlein. Hi, guys. How are you?
Good.
Well, great. So as we think about, I know you guys are like the experts on self-care and how to do this stuff. As you're thinking about this topic, what are some of the ideas that come to you? How can behavioral health organizations support their staff during these tumultuous times?
I can go ahead and start, Dr. Roeschlein. I think there's a couple of things that can be done, both from the leadership perspective, but also from the individual perspective, right? So as an organization, recognizing these things, I think there's the need to make sure that as leaders, we are, practicing what we preach. I know many of us over this last year have talked a lot about, encouraging self-care and making sure that people can do self-care, but I think it's important also for us to be modeling that, knowing that staff often look to the leaders for quote unquote permission, even if it's right, unspoken permission to actually do the self-care. I think the other things that are kind of easy to do is make sure that we, maintain our flexibility in terms of schedules, recognizing that, staff or especially women staff are taking care of children and possibly also teaching at home and all of those things, and making sure that, telehealth is still an option ongoing. Dr. Roeschlein, what are you thinking maybe at the individual level?
Yeah, I to your point around wanting to have that being modeled in the workforce with our leaders and those that we work with, I think it's also important to think about what is the recipe that comes up with resilience, right? And we know that there's specific things that really help us individually. One of them is having compassion. I think women particularly are the bearers of compassion for everyone else, right? We just like exude this understanding and empathy, but oftentimes are really critical with ourselves. And so really trying to hold grace for ourselves during this period, recognizing how important it is to lean into others, to not only for relationship building, but also for meaning making. It's really one of our most adaptive coping mechanisms. And also recognizing that our brains are wired to handle this type of stress. And so some of the best things that we can do for ourselves is really leaning into those coping skills that we've used before, whether that is exercise or trying to eat healthy, just our breath, taking a few moments to breathe in between tasks isn't going to necessarily alter our day in a huge way, but it reminds us to reset the breath so we can kind of get back into our thinking mind.
Well, those are really great ideas. And I think, COVID has certainly got all of us thinking, right, about this balance between work and life and wow, it kind of blurred some of those lines. What are some other ways that organizations are thinking about creating space for staff? And do you have any other suggestions for helping folks really get into this mindset of taking care of themselves?
Yeah. I like the idea that some of the organizations that we work with are doing such innovative things, like really trying to have workplace habits of allowing sufficient time in between meetings. So like 10 minutes break between meetings to allow folks to catch up on communication, to complete documentation, even just to run back to the others in their house to check on them. I think that that's really important. Also, making sure all staff know how to access employee assistance programs, and then using the amazing talents that your staff already have. I know that even here at the National Council, we've been able to, lean into caregivers and clinicians who really excel at yoga or at grounding and mindfulness, and offering those spaces not only just for those that we serve, but those that we serve with, so that we can really all take the time together to heal during this hard time. What about Dr. Henderson-Smith? Any other ideas that I'm not thinking of?
I mean, I think the one that just popped in my head is, recognizing that because we're all in this kind of state of anxiety, right, the ability to focus is kind of harder, right? And it's taking a little bit longer for us to kind of get things done. And so recognizing that, supervisors are the catalyst for real support, right, in our organizations, just supporting the supervisors to support the staff, right? So by doing the check-ins, I know I have several organizations that regularly, like, they do a check-in, check-out with their staff every day to just see how they're doing, right? They've implemented reflective supervision to really kind of check in with them as a whole human, right? Not necessarily just about the clinical or administrative work. I think there's ways that we can just tweak some of the things that we do on a regular basis, like you said, right, to 50-minute meetings instead of 60-minute meetings, to allow people to use the bathroom, drink water, and do even stand up and stretch in between meetings. That can really help with some of those, high stress things that we've been going through.
Well, I mean, I just think about the National Council and how we've implemented like a flex schedule. That's something that we didn't really do before. Do you think that some of these things that we've learned during COVID should continue going forward? What are you kind of telling folks about that?
So I'm telling folks that all of it should stay, right? I think what we've learned is that work-play balance, and I don't like to say work-life balance because a lot of us, work is a part of our life, right? Like, and a lot of us at home is work too. So I like to say work-play balance is super important to the mental well-being, right, of our staff, but also our clients. And so if we can continue in a flexible way, we can continue to offer the options of telehealth, if we can continue to be mindful of our breath and to be supportive of whole human interaction, both with clients and staff, we know that ultimately, right, that leads to better staff engagement. It leads to people not leaving the workplace. It leads to less burnout, which then in turn, right, gives better population health, better service for our clients, and better costs. So, I mean, I think we just have to continue to be flexible and do this kind of hybrid.
Yeah, and I guess the other piece of that makes me think of that two-way communication where, the hope is that organizations are actively seeking out feedback about how things are going, and that staff really feel safe enough to be able to share. And so trying to be adaptive as we go through this process, recognizing what might work for one person might not work for someone else. And so trying to continue to open up the channels of communication to hear what's working and maybe what's not working, and having those venues so that everyone can talk about it. If we stay in silos and don't connect about things that are working, there might be some great things that are happening in one department and not happening in another.
Yeah. Well, isn't it great that good things can even come out of bad situations? And I wouldn't wish COVID on anyone. I would much prefer that it didn't have happened, but maybe there are some things that we can learn through all this ambiguity and suffering. Now, are there any resources you guys want to mention that folks could take advantage of from our website?
Off the top of my head, two that come to mind are the Compassion Resilience Toolkit, which I think Dr. Henderson-Smith was going to mention as well. Just tons of great tools on there, not just for the workplace and organizations, but for families, for working with kiddos that are stressed during this time. I think that's a really great resource. What, Dr. Henderson-Smith, any that come to your mind?
The only other one that came to my mind was the organizational self-care document that we created that's also on our website. So we can definitely share that as well.
Well, and kudos to both of you for helping put all these materials together. This is a great example of how National Council supports our members and the broader community. So thank you guys for that. Thanks to all of you for tuning in for this National Council conversation. We hope you found it useful. Hey, let us know if there are other topics you want us to talk about in future episodes. And thank you for all you do. Thanks for joining us today, and be well, be safe.